Health MEC, Dr. Sibongiseni Dhlomo, is championing the Cuban approach to healthcare and also believes that the community-oriented primary health care needs to be revived and strengthened in the country. And now Dr. Dhlomo joins us in Durban studios. Very good afternoon to you, Dr. Dhlomo. Thank you so much for joining us. Now speak to us of the Cuban approach to healthcare and just why you believe it will work in South Africa.
Thank you very much. I believe it will work because someone was trying to say, well, doctors who come from Cuba who have been trained there, they don't know how to treat TB because there's no TB in Cuba. I said, but why is there no TB in Cuba? Because they actually prevented and stopped it. Now, it's a preventable disease, it's a curable disease. So it means while we have people like me who then work in a big hospital, actually treat those who have got TB. And firstly, it's a myth that doctors who qualify in Cuba do not know how to treat TB. But secondly, even if you were to give them that status that they don't know, they are experts in preventing TB to start in the village, in the communities, because the TB that we see is not coming in from anywhere else other than TB that is in the community. So the approach that they use in Cuba of being preventative, of health promotion, is the most superior approach in the world. It's one of the approach that has made them to eliminate most diseases that we are still grappling with. In any event, if we have a cadre of doctors trained in Cuba, then they will be in the clinics, in the community. You will sit, or I will remain in the hospital and treat those who are already having high blood pressure, diabetes, and they will work hard to prevent those diseases coming up in the communities. Because that's their approach, that's what they've been taught, to prevent and prioritize health promotion.
Now, Dr. Dhlomo, we do need more doctors, all right? But is this the best we can do? I mean, surely the resources we spend on this program could be used even more effectively within the country or the SADC region.
If you are interested in the long term, look, you just have to compare the health indices, the indices of South Africa with the indices of Cuba. They have reduced maternal mortality. They have eliminated malaria. They've wiped away TB. Why? It's because while we cure, but you prevent. So it's like we are only going to be interested in one approach. In fact, even if we were to reduce our sending of students to Cuba, we must actually employ the model that they use there. Right now in South Africa, we are engulfed with the two extremes, preventative, and while you're supposed to be also focusing on actually curative. You'll be surprised that at the beginning of end of this month we'll be visiting London. In London, they are saying they are surprised and they want to hear the model that we are using, because they are sending their students to Cuba only to do the one more year. We are going to be here showcasing our 6 years of students staying in Cuba, coming back. So they want to learn. I'm going to be going to London with 3 more other doctors who qualified in Cuba, actually to go and showcase this program that we are benefiting. In fact, the rural hospitals that we have in KwaZulu-Natal, we are now focusing and giving space for them to be actually pioneered, led by Cuban trained doctors, because those are the most rural hospitals, like the one I visited last week at Dumbe Hospital. Those hospitals must be looked after by the doctors who have qualified in Cuba, because their approach is preventative. And we need people who are going to go out in the community and preach this message of preventing diseases. Come in early, let us screen and see who is actually developing what, and then we treat. That is the way how Cuba has eliminated so many diseases. Now, you can't say, I must leave things as they are, continue to get people diseased, because I'm ready and waiting for them in the hospital to treat them. That's the wrong approach. That is what we call hospice-centric. Sit in the hospital, wait for people to get sick, treat them there, send them back, you wait for another group to be sick. No, that's a wrong approach in the world that we are actually employing. We would want to adopt and move on with the Cuban model of preventative, promotive, and health education.
Well, I quite agree with you there, Dr. Dhlomo, that more attention and more focus should be lavished on the rural infrastructure and facilities, as we've just mentioned. But then, as per the National Development Plan, facilities must be ideal in the next 3 years. So where are we on that? And just speak to us briefly about the new service delivery improvement plan for KwaZulu-Natal. How is that going to work?
Look, we actually have been very strong as a country to adopt this program called National Health Insurance, which talks to the health coverage of all citizens in our country. Now, it starts by actually making available all healthcare professionals to be there in the most remote, not only in the urban and most highly sophisticated hospitals. So we think this re-engineering primary health care, making primary health care the main driver to say, I go out in the community of people who are unsuspecting and people who otherwise think they are well, and screen them and tell them you have a clean bill of health. This other group, you have certain diseases that are beginning to crop up, but I'm screening you and I really want you to go to the clinic, or we'll treat you here and make sure that at a very early stage we are able to prevent complications of disease. Look, even if you go to the community and know that they have a particular disease, diabetes or hypertension, but by being there at a primary level, you are able to delay the onset of complications because you have just got the disease when you are starting and you treated people and gave them health education. That is what we need to drive vigorously. We are starting and we have done some of the areas here, but this is the way to go. And why I'm saying the only way this is going to be strong in our country, in our province, is if we adopt this Cuban model, and use our Cuban trained South Africans when they come back to be there. You'll be surprised that doctors that we have trained in Cuba are much more comfortable to work in the rural hospitals and the clinics, because that is where we see patients for the first time and actually give them support and treat diseases when they're just starting. That is the way to go. That is the way to eliminate diseases in the world. That's the way Cuba has done to eliminate basic diseases that we now talk about in our country.
All right, Dr. Dhlomo, it's always been an absolute pleasure chatting to you. We appreciate your time. But that is KZN Health MEC, Dr. Sibongiseni Dhlomo, is actually championing the Cuban approach to healthcare. Now, he also believes that, the community-orientated primary healthcare needs to be reviewed and strengthened in the country. He's speaking to us live from our Durban studios, and we thank him for his time.